Hi everyone! Praying that all of you are doing well and safe, as well as your families and loved ones. We should not forget to thank God for all the blessings we receive, most especially for our life during this pandemic. Life must go on. Same with your study. So don't ever think that because of those requirements na napakarami, pinahirapan namin kayo. No, that is part of learning process. And you are studying at Chinese General Hospital colleges wherein we are developing and producing competent and excellent nurses. And you'll be one of those future nurses. You must be qualified for that. That's why we are equipping you with knowledge, skills, and attitude. So, enough for this introduction. Let us now proceed to our discussion. I will be giving you example or sample situation on how to compute or calculate intake and output. So make sure you have read the module and watch the other video uploaded so that you can comprehend and you can follow with me. Note also the importance of taking intake and output. Remember, why is that important? Of course, that will serve as your objective data as part of your assessment for you to be able to have the right diagnosis so that the patient also will receive the right treatment. So, through the data, malalaman mo if the patient is dehydrated or fluid overload na ba si patient. So, in this example, the nurse shift is from 7 a.m. to 3 p.m. Patient was admitted to the wardroom 201. She has chief complaint of dizziness, pallor, and body weakness. She underwent an operation 2 weeks ago of radical mastectomy right breast. Upon physical examination, she has also Jackson Pratt present, 25 cc level at the affected area. So from here pa lang, meron na tayong figure. So make sure to note this one. Ito yung drainage, wound drainage ni patient. So meron na siyang 25 cc level. So ibig sabihin hindi mo siya drain, hindi mo binuksan. So may level siya na 25. So tandaan mo yan. At 7 a.m., as ordered by the attending physician, the nurse started an intravenous fluid of plain NSS 1 liter at 30 drops per minute. The patient is on full diet, so she took 1 cup of tea and also two slices of bread. So, ano ba ang entry natin at 7 a.m.? So, i-check mo, the IVF, kaka-start pa lang. So, ibig sabihin, kakasimula pa lang, hindi pa siya pumasok sa katawan ni patient. And, ano ang pumasok sa kanyang katawan? The 1 cup of tea. So, i-note mo yung 1 cup of tea na yan. So, you have to prepare your pen and your paper. So, ilagay natin yung 1 cup of tea. So, here, meron tayong table. At 7 a.m., may intake si patient. Wala siyang output. So, 1 cup of tea, you have to convert it into ml. And, nasa module ninyo yung conversion. So, 1 cup, the standard conversion is 150 ml. And then, at 8 a.m., the patient requested the nurse to change her diaper. The nurse got a new diaper that weighs 100 grams. So, ibig sabihin yung bago, 100 grams. And changed the soiled one. It weighed 350 grams. The nurse did the referral with the doctor. So, ano naman ang figure dito? So, ibig sabihin, meron tayong urine output. Then, ang urine output mo, para makuha mo yun, kasi using the diaper, titimbangin natin yung new diaper versus doon sa soiled diaper. Tapos, i-minus natin. So, 350 minus 100, that will give you 250 grams. Oh. Yung grams naman, 1 gram is equal to 1 cc or 1 ml. So, at 8:30 a.m., Results of hemoglobin level is below normal. So, wala tayong entry dito. Dito lang sa 8 a.m. Meron tayong urine output. So, ilagay na ulit natin yan doon sa ating table. So, at 8 a.m. urine output 250 grams or 250 ml. Remember, lahat ng intake output natin should be at ml or milliliters. So, at 9 a.m., above IBF was stopped temporarily at the level of 750 cc level. So, sabi natin kanina, at 7 o'clock, that is 1,000. So, ibig sabihin na bawasan siya ng 250 cc level kasi 750 na lang yung natira. So, yung 250 cc level saan napunta? Of course, pumasok siya sa body ni client. So, that will be your intake. Blood transfusion of what unit of packed RBC approximately 250 cc level was started at the rate of 20 drops per minute. So, 250 cc level siya. Kaka-start pa lang niya. So, hindi mo pa rin siya ipapasok. Kasi, ibig sabihin, kakasimula lang. Then, at 10 a.m., the nurse removed the patient's diaper, then inserted a urinary catheter aseptically as ordered and drained to scanty yellowish output. So, may entry ba tayo dito? So, wala rin. Kasi walang figure na sinabi. Tinanggal nga niya yung diaper, pero baka naman walang laman. And then, may nakapag-drain nga siya doon sa urine bag, hindi pa niya measure. So, paano ba yung right na pag-measure kapag galing sa urine bag? Although yung urine bag, meron doon sa module niyo yung mga example, it is calibrated, pero kapag doon ka nagbasa, hindi siya accurate. So, usually, ililipat muna siya sa empty IV bottle para mas accurate yung reading mo. Okay? So, dito, at 9 a.m., ito yung IVF natin. So, 250 ml. So, meron na tayong intake dyan. Wala rin tayong output. At 11 a.m., patient X vomited a greenish yellow gastric contents measuring 75 cc. So, ano naman to? Output ulit yan kasi lumabas siya sa body of client. At 12 noon, blood transfusion was consumed and terminated. So, if you remember in the previous slides, ilan ba yung blood transfusion na sinimulan? It was 250 ml, diba? So, yun yung pumasok ulit sa client, sa body ni client. So, kahit walang figure na nakalagay dyan, pero alam mo na yung blood transfusion kanina is 250 ml. So, i-note mo yan. The patient was back to IVF at the same rate. So, nakakasimula lang ulit. So, ilan ba yung isi-start niya ulit? Diba? 750 cc. So, tingnan mo ulit mamaya kung ilan ang mabawas nun. So, here, ang entry natin, 12 p.m., BT is blood transfusion equals 250 ml. Then, at 1 p.m., patient took 1 cup of rice, 1 piece fried bangus and chop suey, and a half glass of water. So, dito nakalagay 1 cup of rice. O baka pag nakita nyo 1 cup, iisipin nyo kaagad, i-convert ko yung 1 cup. Remember na ang intake lang po na i-record natin is fluids lang siya, liquid lang siya. So, rice is not fluid or hindi siya liquid. So, hindi siya kasama doon sa intake mo. Of course, the bangus lalo na hindi. And then, the half glass of water. Ito yung ipapasok natin, yung half glass of water. So, at 1 p.m., half glass of water. If you check again your module, 1 glass, the standard conversion of 1 glass is 200 ml. Half glass lang naman siya. So, half ng 200 is 100 ml. Then, at 2:45 p.m., excited na si nurse umuwi. Kasi malapit na 3 o'clock. So, she measured the intake and output of the patient as follows. IV level is at 400 cc level. So, if you remember, kanina before the blood transfusion, meron tayong 750. So, from 750, doon tayo mag-minus ng 400. So, yung result nun, yun yung intake sa patient. Hindi ka babalik doon sa 1,000 kasi kanina, nirecord mo na yon. Then, she drained the urine bag with output of 550 cc. Jackson Pratt measured 75 cc. So, di ba sabi ko kanina, as we start, you have to note, upon receiving the patient, meron siyang 25 cc level na hindi natin drainain. Kasi usually, kapag wound drainage like Jackson Pratt, chest tube drain, lahat yung mga yon, usually, ang doctor ang nagdi-drain doon kasi di basta-basta natin ginagawa yon. Ang ginagawa natin is nino-note lang natin yung level upon receiving para makita natin kung ilan yung output doon during our shift. So, during sa shift na nurse na to, nung nag-start siya may 25, so 75 minus 25, so that is 50. So, ibig sabihin, may 50 na output during her shift. So, compute for the total intake and output in 8 hours. So, ito na yung ating entry lahat. From 7 a.m. up to bago mag-end yung shift ni nurse. So, ang total intake mo is 1,100 ml. Then, the total output is 925 ml. Then, itutuloy naman natin to. How will you write this down doon sa form? May form tayo. So, ito na yung result ng ating intake and output na na-compute natin based on sa 7 to 3 p.m. na shift ni nurse. Then, ilalagay na natin ito sa form. So, ito yung form ng Chinese Gen. Okay. Actually, ito yung hourly. Ito yung hourly. Ibig sabihin, kapag yung order ng doctor is to get the urine output per hour, ito na yung lalagyan mo ng date, then, yan, for urine and others. Tapos may total siya for AM shift. So, kung hourly, so 8 din lahat yan. 8 hours lahat yan. AM, PM, and night. So, para doon sa date, specific date na yon. Then, eto naman, yung form. Yan. Yan yung form ng Chinese General Hospital ng intake and output. So, you write the date here, and then for AM shift, you have to use the black color ball pen. So, venuclysis, yung mga IBF fluids mo, blood, then oral, lahat ng pumasok orally, and others, then total. So, for AM shift, pag ganon, PM, pag ganyan, then night shift. Tapos, pag natapos na yung AM, PM, si night shift na yung mag-total ng lahat. So, same with your output. Dito sa output, may urine, secretions, vomitus, others, and the total. Then, yung isa, ito lang yung closer. Zoom. Zoom lang natin yung hourly ng urine kapag yung order ng doctor is to get the urine output every hour. Then, ilagay na natin siya halimbawa, yung nakuha natin kanina. So, dito sa shift na to, we will use black ball pen. So, venuclysis. Hindi magkasya kaya ganyan. 600 ml. Tapos, yung blood transfusion natin, which is the red blood cells, 250 ml. Then, yung oral natin, yung ininom ni patient, yung tea and the water. And a total of 1,100 ml. Then, for output naman, ilagay din natin, since AM shift siya, tinotal natin yung urine output sa buong araw niya, I mean sa buong 8-hour shift. Then, yung vomitus niya, others, ito yung Jackson Pratt na drain natin. Then, a total of 925 ml. So, yun lang siya. If you have questions or clarifications, just PM me. And make sure to read the module as well as watch the 2 videos attached so that you can answer the task given. Be honest with your answer. Dapat kayo talaga yung mag-compute. So, have a nice day.